is no unified definition of child sexual abuse. We have different agencies that have definitions, different organizations. Our legal system has different definitions from a federal level that's actually handed down to the state level to interpret. Unfortunately, there's no unified tracking, reporting, or recording data on the national scale. We have Child Protective Services that report child sexual abuse cases within as a caregiver within the home. Then we have the FBI that reports it under sexual assault. So there really is no way to identify the true numbers of this problem. Unfortunately, we also have a societal denial about the issue. It is so difficult that many people just have to put their hands over their ears and over their eyes and not deal with the issue. There's inconsistencies in the criminal punishment. We are dealing with a silent society. Survivors don't have a safe place to open up and disclose. We have a lack of vigilance and lack of education, prevention education in our society when it comes to the issue of child sexual abuse. And we also have many disclosures that are discouraged, whether it's a child disclosing or an adult that's wanting to disclose. And then we all have seen recently in the media with the Jerry Sandusky case, the bystander effect. So our greatest challenge in this moment is really that child sexual abuse is vague, unclear, sporadic. And in this hour, we have to break down these barriers in order for progress and immediate action concerning child sexual abuse to be made in our society. Many don't realize the magnitude of this epidemic. These are CDC statistics that 1 in 4 girls and 1 in 6 boys will be sexually abused before their 18th birthday. Unfortunately, only 1 in 10 will ever tell. The median age of abuse is 9 years old. 70% of all sexual assault happens to a child in the U.S. There are 42 million reported survivors, and we are dealing with a humanitarian public health crisis. So what is the impact of really no unified definition of child sexual abuse? Why is that important? Well, it leaves room for misinterpretation, and that does not guarantee the greatest safety for the child. It also would potentially set up a standard for tracking data collection and data interpretation that could be measured and disseminated. How big is the problem? When we have no unified tracking and reporting and recording of the data, there is an issue to even understand the magnitude of the problem that we're dealing with. And our national data collection systems here in the U.S. have not been updated in nearly 30 years. There is societal denial. There is limited discussion around this issue. There's a desensitized media. Survivors are really left to heal in isolation. Molestation is an acceptable word in our media with really no visual impact of what that act means. If I dent your car and you see a dented bumper, you have a good visual of what that is. So we need to be reporting these violations against children. And we're really blind to sexual abuse all around us. We tend to be living in this arrogance that it's not going to happen in my home, on my street, in my faith center. So what are the societal attitudes that are part of these barriers that are leading to this problem? One is not believing the child's disclosure. The child made it up. The child's lying. The child will just forget about it and get over it. He or she, the perpetrator, speaking of, won't do it again now that they've been caught. Fear of damaging someone's reputation. And honestly, there's a fear of financial loss if the abuser, the perpetrator, is in the home and they are the breadwinner. We're really very desensitized to this issue. It is an emotionally charged topic. Many people have the issue close to them. They know a survivor. They are a survivor. They have a survivor in their family. So it tends to bring up a lot of pain. Unfortunately, there's more concern for the predator. What if I'm wrong? So-and-so would never do that. And the focus is on disclosure, not protection. And what I mean by that is in our society, our defense against child sexual abuse is to wait till the child discloses versus having a proactive approach. Because the damage is done when a child discloses, they have to now heal from the trauma. There is the protection of the predators. 93% of abuse comes from someone the child knows, loves, and trusts. And we are conditioned as a society to be afraid of stranger danger. 68% sexually abused by their own families. 40% of abuse, children and their families or in their social circle, their extended family. And 85% of men incarcerated for child pornography admit that they have acted out on a child sexually. So what is this impact on our society? This impact is destruction of life, innocence, and trust. Our justice system in this area is really failing us. When we look at the penalties for child sexual abuse, I have seen penalties as low as community service. This is an atrocity. We're also dealing with a sick society. Survivors deal with so many self-destructive behaviors: shame, disgrace, mutilation, eating disorders, suicide attempts, sexual promiscuity. Not all social ills are rooted in child sexual abuse, but it's certainly a place that we have to take a look for the health of our society. Drug and alcohol dependence, addiction, 70 to 80%. Depression, post-traumatic stress disorder, anxiety, eating disorders, 80 to 90% are rooted in child sexual abuse. So silence perpetrates the cycle. 40% of sex offenders report sexual abuse as children. Perpetrators are rarely held accountable, and on average, they can have 117 victims in their lifetime, and serial molesters can have up to 400 victims. We've also failed in our society to promote environments of disclosure. I have been at this conference all weekend, and many have come by my table and told me, I'm a survivor and I've never told. We have to come to a place where disclosures are affirmed and supported without judgment. We have to come to a place where really that shame is removed from the victim and placed on the perpetrator where it belongs. And we have to develop a society, we have to teach a society to be compassionate for survivors and to really learn and understand how to nurture them back to health. We have to expose this issue because it is a silent epidemic. We have to help and support the silent survivor that's suffering. We have to help this society bring this issue into the public arena and out of the closet. We have to have a no-tolerance policy for not only child sexual abuse, but for those who are the bystanders, for those who stand and watch it happen. And we saw that acted out in our media last year. And we have to have great compassion for this silent suffering that is going on within our society. If we look at the statistics of 1 in 4 and 1 in 6, we are a survivor, or we know a survivor, or we love a survivor, or we work next to a survivor in a cubicle. Survivors are here and we need to help them heal. So how does Voice Today want to address this? Voice Today is a nonprofit organization that is working to bring this issue out of the closet. We want to bring about 2 social changes. One of those social changes would do, as I said, remove that stigma, that embarrassment from that survivor and place it on the perpetrator where it belongs. Voice Today also wants to shift the responsibility from a child to an adult. We need to make adults responsible for predicting and protecting our children. We also want to teach adults about the risk. Many adults put children in very inadvertent situations where they are at risk to be sexually abused, and they just don't understand. So how? Prevention. Voice Today promotes prevention. We have to have a platform to protect the next generation of children. We have to have an opportunity of discussion, of community discussion. This is a very complex issue, and I in no way am standing here trying to simplify it. But we have to come into a place to understand the complexities of this issue, understand the vulnerabilities of a child, understand the behaviors of a perpetrator, and the pain in their life that would promote such egregious behavior. We have to have sound trainings on how to predict and prevent child sexual abuse. We have to have ready resources, programs, educational tools so that I can stand here and say that child sexual abuse does not happen on our watch. That we can be vigilant and we can build a vigilant society where this type of prevention becomes the tapestry, the fabric of our society. We would live in a society where if we're bringing a child into this world, we would have Lamaze classes and we would have child sexual abuse prevention classes. Last but not least, our 3 pillars: awareness, prevention, and healing. We have to provide healing in community for survivors of child sexual abuse. We have to provide aftercare for survivors of child sexual abuse. Not only do survivors suffer from great emotional trauma, they suffer from great physical trauma. The CDC has released the ACEs study, which links a lot of chronic illnesses to child sexual abuse. We have to understand the problem in such a way that healing is available. You have support groups on every corner for addiction, for depression, for eating disorders. You won't find an open support group for adult survivors of child sexual abuse. And we have to ask ourselves, why is that? We have to provide workshops that address the specific struggles of a survivor, struggles of shame, struggles of low self-esteem and self-confidence and self-worth, workshops that would address boundary issues, trust issues. These are wonderful resources that would help a survivor come into a place of healing. And we have to have a community platform that opens their arms to this issue. We have to have a community platform just like we have responded to the crisis of cancer. When someone gets cancer, they get a card and they get casseroles brought to them and they get love and compassion and they get rides to the doctor. We need that same kind of outreach for survivors of child sexual abuse. So why is this epidemic here and why is it growing? In my opinion, I believe because there is no unified force against child sexual abuse. There are many people doing wonderful work and wonderful things out there, but we need to come together. And what a wonderful opportunity here at this global Humanitarian and Health Summit for us to come together and have a no tolerance policy to say, not on my watch will a child be sexually abused in any part of the world. And the United States has a great opportunity to be a pilot, to be a world leader on how we are going to get awareness and prevention and healing as a model into our communities, and we can duplicate that around the world. There is no significant international movement against child sexual abuse right now, no significant funding, and really that societal denial. Failure is not an option. If these barriers fail to come down, communities worldwide run the risk of propagating a societal message that devalues our children and minimizes their need to be fiercely protected. When we look the other way and a child is being sexually abused, when a child tries to disclose and they're shut down, the message that we're sending our children is you don't matter. That sets them up for failure. So we must unite today. We must unite as a nation and we must unite as a world to bring down these barriers. We must work from the top down and from the bottom up to say that we will not tolerate these horrific crimes against our children. We must have the courage to speak, to be able to give our children the courage to speak, to be able to give our children a voice. So the solutions of courage to speak is to have this courage to speak up and speak out. I ask that if you're sitting here and you're a survivor, to get your voice, to come along beside of us in the voice movement, and to help us protect the next generation of children. The courage to help a survivor break their silence, to help a survivor come into that place of healing. The courage to promote prevention in your communities, and the courage to hold these offenders accountable for their actions. So the voice movement is really about a platform where we can come together on this issue. We can come together as survivors, we can come together as concerned adults for our children, and we can unite to protect the next generation of children. It is so unfortunate that we are saving everything in the world. We're saving the planet, we're saving the dogs, we're saving the cats. We have a huge outreach for many diseases, but rarely do you see a public service announcement or campaign that educates you on what I have taught you today, that 1 in 4 girls and 1 in 6 boys just in the USA will be sexually abused before they're 18, and only 1 in 10 will tell. And that there are 42 million reported survivors. This type of education needs to be in our communities. We need to understand and we need to teach that every child is at risk and every child needs a voice. And we need to be looking at one adult, one child interactions and behaviors. We need to be learning more. We need to be asking our children, teaching them what is appropriate and what is not appropriate. Asking our children, has anyone ever touched you inappropriately? We need to be giving our children a voice. So I am so excited to be here to speak to you today. And with that, I am going to leave you with one of the Voice Today's, one of 3 public service announcements. Thank you. Thank you. I got this. You want to get the flash drive out?